the recent news, we have observed that the institutional birth have been increased to 89% and there is a large amount of impact on the maternal mortality rate. Hello everyone, this is Prathyusha. Welcome to Law Excellence. In this session, we are going to discuss about the different aspects that are being present with the maternal mortality rate. Now first, when we see what is the maternal mortality rate and what it is linked with India, what India has been standing. Now when we see the maternal mortality rate that has been present, it is largely including the death of the mother during or within the 42 days period of time after the delivery. Now here in India, though there is large amount of reduction in the maternal mortality rate has been observed. For example, in India, we can see that in the 2019 and 21 data, we have the maternal mortality rate is 97 for 1 lakh birth. And right now the updated data has been showing that it is somewhere around 83 to 85 death for 1 lakh births that have been there. And we are very near to achieving the sustainable development goal that is around or less than 70 MMR, that is by 2030. Now this is where our target has been there and we are very near. But though there is a despite reduction in the maternal mortality rate, we are seeing large amount of social disparities and interstate disparities are being found. For example, here in the states of Kerala, Maharashtra and Tamil Nadu, they already have reached the below 70 maternal mortality rate has been there. But yet, we do have some other states like the Assam, Uttar Pradesh, Madhya Pradesh, now they are lagging behind in the maternal mortality rate. For example, the Madhya Pradesh which has been present, it is having high amount of maternal mortality rate in India, somewhere around 175 death per 1 lakh birth that has been present. Now when we see what is this maternal mortality rate, what is the conditions or how we have been calculating it. Generally, the maternal mortality rate is considered whenever the number of the maternal death that has been occurring in a given period of time, that is per 1 lakh birth. Now, there are different types that will be coming. First one, we say while they are pregnant, if the death has been occurring, then it is considered as the maternal mortality rate. Or else within 42 days of the termination of the pregnancy, this is where we find the maternal mortality rate has been considered. And we have large amount of causes have been there. One we have is related to the aggravated pregnancy or else the management issues that have been present. Though when we see, we have large amount of data is being present with this MMR. For example, in India, when we see, so from 1990s to present day, the amount of the MMR is being steadily decreasing. For example, in 1990s, we are having around 556 is the data. Then in 2014, it is 130 and 103, 97, now 83, 85 is being present. Now there is a steady decline in the MMR nationally is being found. Then we also have the high performing states that have been there. For example, Kerala, it is less than 19, then Maharashtra less than 33, Tamil Nadu less than 55, and we have the other states that are having high amount of the MMR. Now when we see what are the concerns, why India had such a high amount of MMR during the 1990s and how it has been reducing. The first one, when we see why did we have large amount of maternal mortality death, we can contribute it to the poor infrastructure. Now the infrastructure, for example, in the Madhya Pradesh itself, whenever the institutional birth has to be occurring or the nearby public health care services that are being present are somewhere 5 to 8 kilometers distance has been there. There's a report that has been present in this data also. It is stating that the institutionalized infrastructure is very far from the rural villages and rural India. The infrastructure deficiency gaps are being present. Second, there is large amount of gender inequality has been there, poverty has been present, and there is also maternal mortality death is linked with certain conditions. For example, malnutrition, anemia, low female literacy. For example, according to a report, we have a 57% of Indian women are anemic in nature. Low amount of iron is being present, and for pregnancy iron has been a very important component. Then we have low female literacy. Now whenever the literacy is not being present, not having a proper awareness about institutional birth, the infections that can come after post delivery during the pregnancy period of time. Now low literacy is again causing a hindrance towards the development and also malnutrition. So we have less amount of nutrition is being given to the female generally from the growth, and during the pregnancy we find nutrition deficiencies are being found in the women. Now this is where we have been having the impact has been present. Then let's see what are the key government schemes that have been functioning which are reducing the maternal mortality rate in India. For example, first one we have is the Janani Suraksha Yojana. Now this is a cash intensive scheme that has been there where institutionalized deliveries. For example, whenever a delivery is being done in the institutions, government hospitals, government or secondary healthcare services infrastructure. Now cash benefits are being given, and these cash benefits are being given to the below poverty line families in the urban areas and to the SC and ST communities in the rural India. Now this is where we have been having the cash intensive. So this is where we have increased 89% of our institutional deliveries are being coming. Then second one we have Janani Sishu Suraksha Karyalayam. It is for the free deliveries that have been there. Now in the government institutions also, we have been promoting the free deliveries, free giving diagnostics, free drugs that have been there, medicines are being provided to them. Then we have Pradhan Mantri Surakshit Matritva Abhiyan, where we have been trying to ensure that a regular checkup is being done during the pregnancy. For example, for one antenatal checkup on 9th of every month, so specialized care is being provided. Early pregnancy education is being provided to the women. Then we have the Suman initiatives. Now this is where we have been trying to have a dignified, respective and the zero cost maternity care we have been coming up. Then we have the Lakshya program where we are trying to increase the infrastructure. First one, we are trying to increase the labor room quality improvement and is also focusing on care and not just access. Now these are some of the schemes that have been present. We also have different nutritional schemes that have been present where we are trying to provide the cash intensive where 6,000 rupees are being given, where with registration 1,000 is being given, before the delivery 2,000 is being given, and after the delivery during the immunization another 2,000 is being given. So large number of schemes are being implementing to reduce the MMR and to increase the institutionalized birth. What are the challenges? Now let's see what are the challenges that are being present. First one is that we have large amount of interstate and intrastate disparities have been present. As we have observed, some of the states the MMR is far below the 70, already reached the SDG goals 3.2, but at the same time some of the states are having very high amount of the MMR. Now interstate has been present. Even in the intrastates, urban areas that have been there we usually find less amount of the MMR has been there, whereas the rural India and the tribal regions, now here we are having large amount of MMR has been present. Second, high MMR in the tribal, rural and the aspirational district. Third, shortage of specialists. Now this is one common problem. Though there are 19 medical colleges in India, now how many amount of the doctors have been working in the rural India, specialized the gynecologist and the anesthesiologist, they are present in the rural India is still a question mark. Then we have poor quality of care in some of the public facilities, the primary health centers, the secondary health centers. Now they are not equipped with proper labor room facilities, proper medical facilities, or trained professionals should be present. Then underreporting of the maternal death in the remote areas. Now this is an hindrance. MMR we have been calculating, but underreporting is causing a hindrance for the calculation of the MMR in the country. Now let us also see what are the way forward. Now how can we even more decrease the MMR and reach the sustainable development goals? For example, we are trying to target the MMR reduction in the regions where we are having high amount of values have been there. Then we are trying to strengthen the primary health care and the referral systems. We are trying to improve the nutrition and the anemic control, promoting the delayed marriages. No, generally the WHO has been considering that the institutional deliveries, the women deliveries, about 22 years has been a present. No, before 22 years, adolescence delivery is usually increasing the MMR ratio. No, this is what it's been told. So we are trying to delay the marriage, and also spacing between the birth has been present. Now this spacing between the birth allows the woman body to recover and have a safe pregnancy and the safe childbirth. Then we have expand telemedicine and e-sanjeevani for the antenatal care. So with the help of the AI technology, with the help of the networking technology, we can provide the telemedicine to the rural communities, rural area, antenatal care, and the knowledge can be imparted to them. Then we are trying to improve the quality of care and not just the coverage, strengthening the maternal death audits for the accountability. Now through this we can enhance and reach our goal, reduce the maternal mortality rate, increase the amount of institutional deliveries to 100% and reach the sustainable development goals. Let us observe one of the practice question. India's MMR data is officially released by A. Niti Aayog, B. NF, National Family Health Survey, C. Register General of India, D. Ministry of Women and the Child Development. Do comment the right answer. Let's also see one mains question regarding this. Despite significant reduction in the maternal mortality ratio, regional disparity persists in India. Analyze the reasons and suggest the measures to bridge the gap. Now what are the session that we have discussed? Starting from the start, we have given the gaps that are being present. We are telling what are the, why it is very much high. Then we told about challenges. We told about the way forward that has been there. Now with this, a comprehensive understanding can be made and the answer can be prepared. We will meet again with an interesting video. Thank you.